The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, cosmetic dentist Dr. Guy Lewis talks about some unique procedures in dentistry he has developed. Minimally invasive spine surgeon Dr. Douglas Wan talks about an innovative surgical technique he developed called Lumini microinvasive surgery. Craniofacial and plastic surgeon Dr. David Jenikov walks us through the process to treat a child born with a cleft lip and palate. Learn more about the Texas Heart Institute and their doctors with interventional cardiologist Dr. Annie Varghese. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
I had always dreamed of having just a perfect smile. When you walk into a room and you smile, everyone notices you. I would smile in pictures, but I would always be very critical of it. It was never the smile that I was happy with.
People who are candidates for veneers are usually people who have crooked teeth, who want them to look straighter. I was kind of one of the pioneers in a process called instant orthodontics, where instead of going through braces to straighten the teeth, we can make the teeth look straight by doing veneers.
So when I first came in, I didn't know what I wanted. I just knew that I wanted a pretty smile. They took a bunch of pictures and they listened to my concerns. The best option for me was the G. Lewis veneers because they're very thin and it wouldn't require any changes to my teeth as is.
People normally come in for a consultation where I just look at their smile, listen to what their concerns are, what they're wanting to accomplish, what they like or don't like about their smile, and then we try to custom design a plan for them. I developed some other kinds of veneers called G. Lewis veneers, which are a non-prep veneer. And what that means is that I can do those without having to do anything to the teeth, without grinding on the teeth, without reducing the teeth at all. For people who have fairly straight teeth or teeth that kind of have a cant inward, they're a great option because you could do them. You're not doing anything to the teeth. This was a way that we developed to make them look great and be very non-invasive.
I actually like coming to the dentist when I come here. Every time I come in, I feel very welcome and I feel like I'm almost just like part of the G. Lewis family. Now I smile all of the time, every time. Everyone always compliments me no matter where I go. I have people come up to me and they say, "Your smile is gorgeous." The best part about it is that it looks so real. Now I have a perfect smile.
Did you know that establishing a bedtime ritual helps your body know when it is time to sleep? You can establish a bedtime ritual by doing the same things, such as brushing your teeth, reading a book, or listening to soothing music every night an hour or two before bedtime to relax your mind.
procedure, and it is done while the patient is asleep. An analogy that I like to use with my patients is like placing an egg white in a fry pan and watching the clear color turn to a white color. That's coagulation of the protein, and that is exactly what happens during the endometrial ablation. Women are very satisfied being able to keep their uterus, but no longer having to deal with menstrual problems, menstrual irregularities, or even menstruating at all.
I'm glad I did, because one of them, she saw one and she didn't know that there was another one behind it, and that one was the one that was questionable and probably would have turned into cancer, and that's a very scary word to me, and I'm very glad that I had it done. It's over, and when they say a weight has been lifted off your shoulders, it's true. For some reason, I feel lighter. I'm more sillier than I normally am, and I'm just enjoying my life.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com. Find your doctor on bestdocsnetwork.com.
At Lumen Health Spine Care, we developed the latest and the most innovative minimally invasive surgical technique, and it is called Lumini Microinvasive Surgery. This is utilizing the most modern technology so that we can preserve all the normal tissues in your spine without creating any kind of damage to your back and without stripping the muscles. We make extremely small incision and go between the muscle fibers with an endoscope to perform the same procedure as if we perform a traditional open back surgery. The big advantage is that the patients are not going to have significant amount of pain. They're not going to have their muscles stripped off their spine, so therefore it minimizes the bleeding, scarring, pain, so that they could recover so much faster. Patients after undergoing Lumini microinvasive surgery are discharged to home on the same day or the very next day, depending on the type of procedure they're having. And many of the patients can return back to work or their light duty activities pretty immediately after the surgery. So we evaluate the patient to see if they're candidate for Lumini microinvasive surgery by having a full consultation and evaluation, and patient may undergo imaging studies or pain mapping process by our interventional pain specialist so that we can clearly identify and accurately identify their pain generator, and so that we can perform the least invasive procedure for the patient. We developed Lumini microinvasive surgery because I personally witnessed it from my father, who had multiple open back surgery. He went through a significant amount of pain, developed chronic pain, and he had a failed back syndrome and lived 30 years of his life with significant amount of pain. And watching him suffer, I realized that we must do something better than what we're doing now to help all those patients with significant amount of back pain and chronic pain. So we used all the latest technology, worked closely with the engineers to develop the least invasive way to approach the spine.
At 20 weeks, we found out we were going to have a baby with a cleft lip and palate, and we were looking for a doctor, a craniofacial surgeon, and we found one of the best. And we feel very lucky that we had found Dr. Jenikov.
We could see something, but we didn't ever put two and two together. We had no idea. We went to some other doctors that kind of put some things in our heads that I didn't really appreciate at the time. But when we got down here and saw Dr. Jenikov, he put us at ease a whole lot.
Fortunately for us today, 80% of the patients we see with a cleft lip and palate are diagnosed on ultrasound around 20 weeks. So we get to see the patients before they're really patients. We get to talk to the mom and the dad and really begin the education process at 20 weeks gestation as opposed to 2 weeks after the baby's born.
He guided us through the whole thing and treated us along with Tate. He kept us where we needed to be.
That first surgery was pretty sweet when Dr. Jenikov, here we had to hand off our child that we'd fallen in love with the face that we got when he was born. And after that first surgery, when we were in the waiting room waiting and we knew he was in recovery, and Dr. Jenikov actually came and got us, and he wanted to see the reaction on our face, to see his little face for the first time. And that was sweet, and just knowing that it was his reward.
Tate's a normal kid. He's got a big brother that he fights with all the time. He goes to school, he runs around, he chases everything else he can chase, and he's a wonderful, sweet kid.
We've just been real careful and made sure that this is not who Tate is. This is part of our journey. This doesn't define us of who he is. We're not going to use this as a crutch in our life.
We are using it as an experience to make us a better family and a closer family. And Dr. Jenikov and his office have made this, for a rotten situation, the best experience I think we possibly could have had.
Did you know eating oysters can keep your immune system strong? A 3-ounce serving has 1/4 of your daily iron intake, plus twice the zinc that you need in a day.
Welcome. Today we're joined by Dr. Denton Cooley, a native Houstonian and the actual founder of the Texas Heart Institute. What a pleasure to be with you today, Dr. Cooley. Thank you for joining us.
Well, you're welcome, and thank you for visiting our institution.
Can you tell us a little background about how the Texas Heart Institute became an entity?
Well, it, I think, began in the mid-1950s when open heart surgery was first introduced in our Texas Medical Center. And before long, my program here at St. Luke's and Children's Hospital was probably the most prolific of all institutions in the country, including the Mayo Clinic, and Cleveland Clinic, and everything. And we had a simplified technique of open heart surgery and soon began a leadership position in this new field of cardiac surgery. Well, then I decided to create this institute in 1962. So it's been a little over 50 years ago.
What is your most vivid memory about the Texas Heart Institute, about any type of incredible learning that has been occurring here? What's your greatest memory?
Well, of course, our Heart Institute was created with two objectives, that is, research and education. So in each of those aspects of our history, I think there are certain exciting things that have happened.
And when the Texas Heart Institute first came into being, cardiothoracic surgery was high on the list of available procedures to be done for patients. Now we have the artificial heart and the LVADs. And so would you tell the audience about that?
Well, I think that it shows the evolution of cardiac surgery. First, we started off replacing just some of the components of the human heart. That is the valves and the great vessels, and modifying the ventricles and that sort of thing. And then the big breakthrough came in 1968 when we did the first successful heart transplant to replace the entire organ. And that was really an exciting period that followed that. It was such a new concept.
Amazing, right?
Yeah.
And we have actual volunteers here at the hospital who have been survivors from cardiac transplant for about 20 years now.
Oh, yes. Our initial work in transplantation, we did, I think, about 15 or 20 heart transplants in that early era. But so many of these patients suffered from rejection of the tissues. But in the early 1980s, a new breakthrough came with the development of a drug called cyclosporin, which is still in use today and has made it possible for some patients to survive transplantation for 20 or 30 years. So it's a really big change.
quite miraculous, and you are such a part of that endeavor, and we humbly thank you for everything you've done for the world population, actually.
Well, it's been a great satisfaction to me to see how this institution and our whole medical center has grown during my lifetime.
Thank you, and now we're taking you again all over the world with Best Docs Network, and we just wonder if you have something in these closing remarks, if you can tell our public something about the Texas Heart Institute that you would like them to take to heart.
Well, I think that we have done a great deal to reach our original objective of research and education, but at the same time, we've made many advances in just clinical medicine and surgery, and have enjoyed a leadership position in this new development now. It's sort of inspired the entire medical community around the world, and you can find large cardiac programs going in Europe and South America and elsewhere in North America. Just amazing to see how rapidly it's expanded.
Well, for all of us who have trained under your great leadership, we humbly thank you, and we give you great honor, Dr. Cooley. Thank you for being with us today.
Oh, thank you.
Coming up on the second half of today's show, ENT surgeon Dr. C.T. Nguyen talks about how he treats those with postnasal drip and deviated septums. Family medicine doctor Richard Honecker addresses common health concerns in our Medical Minute. Learn more about the outstanding medical facility Houston Northwest Medical Center, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple course of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Request an appointment on bestdocsnetwork.com.
We've all had heartburn. Now, it's kind of odd because it has nothing to do with your heart, but it sure does burn. And what causes it? Usually it's when acid leaks up through that little round muscle that's supposed to be nice and tight and keep acid in the stomach, that acid leaks up into the esophagus. So what makes that happen? What loosens up that little round muscle? Alcohol does it, caffeine, chocolate, cigarette smoke, peppermint, spearmint, tomatoes, that kind of stuff we're all guilty of. So what do? You go out to a restaurant, you have a drink or two, you eat a fatty meal, and then as you leave, you take a peppermint with you. And all of that relaxes that little muscle so the acid can come north. You go to sleep and lie down in bed, and boom, the acid's in your esophagus. That's no fun. It can cause painful burning, even some hoarseness as the acid leaks up and irritates your vocal cords at night. So what can you do? Well, first of all, reduce those things I just spoke about. Secondly, you can get over-the-counter medications. There's two kinds. There's strong stuff and there's weak stuff over the counter. Ask your pharmacist which one might be best for you, or ask your doctor.
In most of the bariatric procedures do two things. They decrease your appetite and they decrease your meal size by constricting the gastric pouch to a very small pouch. With a gastric bypass, we form that small pouch about the size of a golf ball from the top of the stomach. Then to drain that, or to get the food back into the food channel, we bring up the small intestine and sew it to the little pouch so it has some place to drain.
Back in 2006, I went in to have heart surgery. I had 5 bypasses. After that, my weight just continued to blossom. I had diabetes, and I couldn't maintain it. I was taking 4 shots a day, pills, high cholesterol.
Ron came in and he was in lower BMI category, but he had so much impairment in his daily activities. He had previous heart surgery with 5 bypasses, cardiac bypasses. He had diabetes, high blood pressure, sleep apnea, and a number of other medical problems.
When I went in and talked to him, he told me about 3 procedures: the band, the sleeve, and the bypass. After examining me and looking at my background, he said the bypass was the perfect thing for me for diabetes. So I chose to do the bypass.
And basically, all of those have resolved after his gastric bypass. He was on insulin for his diabetes, he was on medication for his high blood pressure, for his cholesterol, and he is also racing cars now. And he enjoys that very much with his son, and so he's got a new lease on life and a much better quality of life than he had before.
My quality of life right now is so great. I want to live, I want to wake up. Matter of fact, I just want to go all the time. I've got so much energy. I love all kinds of sports, and now I can do them thanks to Dr. Barker. It's a miracle. It's a miracle. I wish I had done it a long time before I had. Dr. Barker saved my life. This saved my life.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Another reason to stay hydrated throughout the day is because your brain is composed of 75% water. Your brain will also begin shrinking 0.25% in mass each year after the age of 30.
Frank has a question for Dr. Nikki Fox. What are the alternatives to pain medicine to alleviate my pain?
At this point, we have specific minimally invasive procedures that we can utilize to address both pain that stays in one particular area as well as pain that radiates into the extremities, whether it be the arms or the legs. These are specific procedures that either inject medication directly into the what's called the epidural space in the back or along selective nerve root levels themselves. We also have procedures available that can actually burn the nerves or the peripheral sensory nerves that send pain signals from the back or the neck to the brain and lesion those for an extended period of time for pain relief.
Ask our doctors on bestdocsnetwork.com.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided, the hospital quickly grew into a regional healthcare provider serving not just the immediate area, but really all of North Houston.
When I joined the hospital 23 years ago, the things that stood out were, number one, the facility itself. The facility was second to none with respect to the services it provided.
Houston Northwest Medical Center is well known for the high quality care it's given since it's been opened. Since the first cardiac procedure in 1984, the hospital has continued to grow.
We do every kind of surgery, from the small to the large. We do from toenails to open heart. We have a very large bariatric program. We did about 500 cases last year.
As the years have gone on, we have been known for cardiovascular surgery. For cardiology procedures, we have a beautiful cardiac cath laboratory. Our OB department has just grown through the years.
Here at Houston Northwest, we have a lot to be proud of, not only in the quality of services we provide, but in the scope of services we provide. We are the third largest ER provider in the greater Houston area, and we're the largest outside of the medical center downtown.
The attention to detail is phenomenal, from the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.